Dissection of the viscera in situ. For this, the incision has been given along the lower margin of the ribs, and then the whole skin flap and the abdominal muscle has been elevated. Now, this is how it looks after removing the peritoneum. Along with the umbilicus, we can see there are three folds. This is the median umbilical fold, which is formed by the obliterated median umbilical ligament. Then this one is the medial umbilical fold, which is formed by the obliterated umbilical artery. And this is the lateral umbilical fold, both sides, which is formed by the obliterated inferior epigastric artery. Here we can see in the superior margin, there you can see the part of the falciform ligament. This is the falciform ligament. Here we can see this is also the falciform ligament, which is containing the ligamentum teres. This is the ligamentum teres. Along the lesser curvature of the stomach, this is the lesser curvature of the stomach. So along the lesser curvature of stomach, we will find the lesser omentum. So this is the lesser omentum, and from the greater curvature of the stomach towards the transverse colon, we are getting the greater omentum. Now, on lifting the greater omentum, we can see there is a transverse colon, and in the transverse colon there is a broad fold of the peritoneum is present, which is known as a transverse mesocolon. On lifting up the ileum and the jejunum, we can see there is a fan fold shaped of the peritoneum is present, and this all are known as the mesentery. So this is the mesentery, right? Beneath the liver, you can see there is a greenish structure is there. This is the greenish structure. So this is the gallbladder. Okay, so this is the gallbladder, and from where the falciform ligament is getting into the liver, in that part we can see there is a caudate lobe, and beneath the caudate lobe, when I will insert a finger, my finger is getting inserted into the epiploic foramen. So this is the epiploic foramen, which is the communication of the lesser sac with the greater sac. So in this body you can see very nicely the liver, and you can appreciate the left lobe of the liver as well as the right lobe of the liver, and the division. On the division point, you can see there is a falciform ligament along with the ligamentum teres. This greenish structure, this is the gallbladder. Okay, now this is the stomach. In this stomach, you can appreciate very nicely the greater curvature. This is the big stomach. So this is the greater curvature, and this is the lesser curvature. And along the lesser curvature, we will get the lesser omentum. So this is the lesser omentum, and along the greater curvature we will get the greater omentum. This one is the greater omentum. On lifting up the greater omentum, we can see this one is the transverse colon. Okay, so this is the transverse colon. Along the transverse colon, what we are getting? We are getting the transverse mesocolon. These all are the transverse mesocolon. And this is the loops of the ileum and the jejunum, and in this we can appreciate the mesentery.